Hi, my name is Kristen Swift, and I am the EVP of the PTSA at the high school. Tonight, we have an amazing speaker. We have a student tonight, which is fantastic. It's Sadie Metcalf. She's a senior at South Pasadena High School. She is a youth advisor for the LA Department of Health. She's a health and wellness officer at the school, Planned Parenthood peer advocate and educator, and she is here to talk to us about HPV and its vaccine. So I'm going to turn it over to her right now. Thanks, Sadie.
Hi, everyone. So happy you could be here. I'm going to go ahead and share my screen and we will get started. All righty. Okay, so this is my HPV vaccination awareness. It's a quick presentation about HPV and its vaccine. So just a couple of content warnings before we get started. There is mention of sexually transmitted diseases and their symptoms. I also encourage you to take a break at any point during this presentation if you feel overwhelmed. It will be recorded, so you can go ahead and watch it later. Also, feel free to ask a question at any point during this presentation. Kristen's can kind of manage the questions at the end, and you can, either put them in the chat or just privately DM one of us. All right, so a couple of, our roadmap here. We're going to go over some HPV and STI, just basic information. Then we're going to go to HPV prevention and the HPV vaccine. Then we're going to go into some youth rights and access to services. And then I'm going to go over some recommendations for you all. So a little bit about me. I'm Sadie. I use she, her pronouns. I'm a graduating senior this year at South Pasadena High School. I am a youth advisor for the Los Angeles Department of Public Health. So I advise on a lot of public health projects. And then I also complete a passion project each year. So this year, the passion project is HPV. I'm also the health and wellness officer at South Pass High School, where I work really closely with ASB and with the student body to provide them with health resources on campus. I'm a Planned Parenthood peer advocate and educator. So I've been, highly trained in teaching about STIs and about birth control. And I work to do a passion project for that every year also. And then I also recently completed my Gold Award project for Girl Scouts, which I named Let's Talk Sex. So I did a lot of research on STIs and access to STI care in the South Pasadena area just last year. So what is HPV? We're gonna do a little quiz on Kahoot just to see how much you know about HPV. So please go ahead and open Kahoot it. And then I'm going to stop sharing my screen for a second and reshare the screen. All righty. So go ahead and type in kahoot.it, and the game pin is just here at the top. I think you could also, scan this QR code if you feel that is easier for you. And we'll wait for just a minute. Okay, go ahead and raise your hand if you're actively trying to get on to the Kahoot. Okay, take your time. Okay, I'll give it about 30 more seconds. If you can't manage to get onto the Kahoot, totally fine. You can just, test yourself and go along. Alrighty. I am gonna go ahead and start this. True or false? HPV can cause cancer. Okay, awesome. You all got it right. HPV can cause cancer. It causes a bunch of different kinds of cancer, the main one being cervical cancer, but it can also cause throat cancer. It can cause anal cancer, penile cancer, and then it can also cause some kinds of precancers as well. And we'll go over that in a bit.
Sadie, can you give us that PIN number again? I'm finally
Sure.
in, so sorry.
Let me go ahead and try to find that. The PIN number is 627 6122.
Thank you.
Yep, of course. Alrighty, true or false? Only people with uteruses need to get the HPV vaccine, not people with penises. So true or false? Yeah, false. Everybody needs to get the HPV vaccine, no matter of internal or external reproductive organs. All right, moving on. Doing pretty good. True or false? HPV is a rare and uncommon sexually transmitted disease. False. In fact, it is the most common sexually transmitted disease. Good job, guys. We're moving on. True or false? You can get HPV without having penetrative sexual intercourse. True. So you can get HPV without having penetrative sexual intercourse. It's also passed from intimate skin-to-skin contact. Yeah. Here we go. True or false? There are treatments for HPV. This is a very trick question. There is no treatment for HPV. There's no cure for HPV, but there are treatments for the symptoms of HPV. So that includes, genital warts. That includes the cancers, the precancers, stuff like that. But there's no treatment for HPV. All right, I got you there. We're moving on. True or false? Youth don't need the HPV vaccine until they are ready to have sex. Yep, false. You need to get the vaccine at around 11 to 12 years old for it to be most effective. And we'll go over that in a bit. All right. Minors in California have access to, without parental consent, birth control methods, abortion services, STI prevention and care services, and pregnancy care and treatment. Without parental consent at any age in California, minors have access to all right, we're going to go over this later. But minors at any age in California have access to birth control methods, abortion services, and pregnancy care and treatment. And then minors 12 and over have access to STI prevention and care services, which includes the HPV vaccine. We're moving on. I think we're on question 8. Yep. How many different kinds of birth control are there? All right, there are 20 individual different kinds of birth control, and there's kind of 5 major, subgroups, and I'm just going to go over them really quickly. Those are behavioral methods, so that's an example of that is abstinence. There's emergency methods like Plan B, and there's permanent methods like tubal ligation or like a vasectomy. There's hormonal methods like the pill or the patch or the implant, and then there's also barrier methods like condoms. All right. What is the most common symptom of an STI? Genital warts, rash, or itchiness, no symptoms at all, a fever, painful urination. All right, yeah, most of you got that. The most common symptom of an STI is actually no symptoms at all. So you could have an STI and you would never know about it until you get symptoms or you get tested. All right. And this last question is a typing question. So where can you get the HPV vaccine? Alrighty, doctor's office, clinic, pharmacy. So you guys all got them right. A doctor's office, a clinic, a pharmacy, those are all places where you can get the HPV vaccine. All right, I guess we'll do the little podium. At third place, Lauren, good job, Lauren. Second place, Anna, good job, Anna. And first place is Tyra, yay, Tyra. Okay, I hope that was minorly fun for you guys. I'm going to go ahead and stop sharing and then reshare my presentation. All right. All righty. Let's get back into it. So what is HPV? HPV stands for human papillomavirus, and it is the most common STI, which stands for sexually transmitted infection. It's an infection in which one gets genital warts, and HPV can cause some kinds of cancer. So I talked about that earlier. Cervical cancer, vulvar cancer, penile cancer, anal cancer, some kinds of throat cancer. But the good news is HPV is completely preventable. A recent study conducted by the CDC found that 85% of all people will contract HPV at least once in their lifetime. There's a bunch of different strains of HPV, and it is the most common STI in the world. But good news again, the HPV vaccine can and will prevent HPV and all resulting health problems, including the several kinds of cancer that I mentioned earlier. So what are sexually transmitted infections? These are infections that are passed from one person to another through sexual contact. And there's three major kinds of STIs. Bacterial, which is caused by bacteria, obviously. An example of that is syphilis. Viral, which is caused by a virus. So HIV/AIDS and HPV is a viral. And then parasitic is caused by a parasite. So that's trichomoniasis, pubic lice, scabies. Those are all kinds of parasitic. All right, prevention of STIs. So the most effective form of prevention is abstinence, so just abstaining from sexual contact or sexual intercourse completely. But there are different methods also. So condoms are a really good way to help prevent STIs. Having open communication with your partner or partners about STIs. Getting STI tested is also very, very important. And then treatment for those STIs. And then just general kind of hygiene steps. So like washing your hands, peeing before and after sex. And then avoiding shaving and waxing pubic hair can also help prevent STIs. And then an important note is if STIs are contracted, just fully avoid sexual contact until you're fully treated and are cleared by a medical doctor. All right, so we're going to do another quick activity. So go ahead and type in mentimeter.com. And then I'm going to have you type in this code, and I'm going to put it in the chat also.
Wait, can you say that again, what we're supposed to type in?
Yes, I'm putting that in the chat.
Okay.
Right there. And then the code for that is at the top. I will type that in as well. And the question that's at the top of the screen once you pull this up is, what words come to mind when you think of sexual education? And we'll go ahead and wait for just a minute for you guys to pull that up and fill out the question. Okay, some of the words that I'm seeing, the big ones are important. That's the most common answer among you. Necessary is another big one. Vital, another big one. Awkward, for sure. Controversial, that one's kind of interesting. Safe, also very, very, very true. Confusing or embarrassing. Heterosexual, also very true. Okay, and I'm going to kind of segue back to my presentation, but I want you to keep these words in mind, especially, important and necessary, vital, as we segue back. So I want to talk a little bit about the stigma behind STIs and sexual health. So you all mentioned that, sexual health and sexual health education is important and it's vital and it's necessary. But even though we think like that, and many of us think like that, a lot of people don't. And there's a lot of stigma behind sexual health and sexual health education that prevents people from, being safe when having sex. So it contributes to a lack of accurate information and education for young people, especially. There's a lack of access in schools to protection and information about how to use protection. So, having condoms in nurses' office is a great way to get that started, but a lot of schools have, a general stigma about that. And then also the stigma leads to just general embarrassment to get tested or tell partners or get treatment. And it prevents them from being healthy and prevents them from being safe. So moving on, what is the HPV vaccine? All right, this slide is a little bit texty, but no need to worry. The HPV vaccine in the United States is called Gardasil 9. It protects against 9 different HPV strains, and it's available for anybody aged 11 to 45, but it's most recommended and most effective if administered at 11 to 12 years old. And at 11 to 12 years old, you're administered 2 doses, which is 6 to 12 months apart. But if you wait until you're older, an extra 3rd dose is recommended and required to actually, get that most effectiveness out of the vaccine. How do you get the vaccine? So many healthcare clinics stock that, and STI clinics like Planned Parenthood. You can also get it, just at your doctor's office. Your general pediatrician should have HPV vaccines readily available for you. Some school-based health centers also, these, aren't really in high schools, but in colleges, some health centers do provide the HPV vaccine. Health departments can also provide it. And then some state programs can offer the HPV vaccine for free. So you can ask your doctor or call 211 to find a clinic near you to get that HPV vaccine. All right. You might be thinking, 11 to 12 years old, that's way too early. My kid's not having sex. Why would I need to vaccinate them at all? That early, I'll just get it later. But like I mentioned, the HPV vaccine is most effective when gotten at 11 to 12 years old. So even though it's administered at 11, 12 years old, later in your life, it will be most effective to prevent against HPV if gotten at that age. All right, and I'm going to mention this graph. So as the ASB Health and Wellness Officer, we administered the survey in the beginning of the year. And one of the questions asked of the entire student body, have you been vaccinated against HPV? We got nearly 700 responses. And I just want to kind of explain this graph to you. So 43% of the respondents said that they had gotten the HPV vaccine. 8.2% said they hadn't gotten the HPV vaccine and they knew that for sure. But the overwhelming majority of students said that they were unsure if they've ever gotten the HPV vaccine, which is kind of interesting. And it kind of also points out, people don't know what it is. People don't know what HPV is. People don't know what it does for you. And on this next slide, I'm going to provide some resources to see if you can check. So how do you check if you've been vaccinated against HPV? You can check your vaccination records. Obviously, it looks like this little yellow card. You can check with the child's primary care doctor. And then for easier access, you can also use the California Immunization Registry for an online version of vaccination records, but you have to have set that up beforehand. All right, so HPV treatment. What to do if you've already been infected. Like I said before, there's no definitive treatment for HPV, but there are treatments for the symptoms of HPV. So that includes genital warts. You can go to a doctor and it can usually go away with prescribed medicine. Cervical precancer pap tests can reveal a precancer and can be treated if caught early. Sorry for that typo there. And then other HPV related cancers, depending on the stage, the cancer can be treated. And I also want to point out that even though there's no treatment for HPV, your body is really good at making antibodies that can get rid of HPV. And usually it's within 2 years, but sometimes the body actually doesn't make those antibodies and HPV remains in your body forever, which means you could pass it on to more people. So definitely get tested. A good way to start is to get tested for HPV. All right, so the costs of STI testing, I just wanted to go over this really quick. STI testing costs anywhere from, no money at all to about $250, depending on the test that you need, where you go, your income, whether or not you have insurance, or whether or not you need an exam. Planned Parenthood is a great place to get testing if you have a low income and little insurance. And each dose of the HPV vaccine costs up to $250. But if you have insurance, most programs completely cover the costs of both, or the 3 doses that you're required to get. So that's good news. All right, I want to pause really, really quickly and see if anybody has any questions about what I've covered so far about HPV, the vaccine, STIs, and you're going to go ahead and put those in the chat.
I'm not seeing any yet.
Awesome. If not, we can save it for the end.
Sounds good.
We're going to move on to youth rights and access to services. So I want to include this in this section because I know a lot about it and it connects pretty well to you as a parent or as a kid. Okay, so youth rights related to STIs. I talked about this a little bit earlier, but California youth aged 12 and over have access to STI prevention, testing, and treatment methods without the consent of a guardian. So if you go into Planned Parenthood and you're over 12 years old in California, you can ask them for STI testing without them having to tell your parent or guardian. That being said, it's kind of difficult because usually you'd want to pay with insurance, and the insurance companies can tell your parents. So if you come in with just cash and you're ready to pay, it doesn't have to go to your parents. But usually that's inhibited by some insurance policies. But this also includes prevention for HPV, aka the HPV vaccine, which is pretty interesting. And then youth rights, regarding everything else. In the state of California, minors at any age have access to pregnancy cares, that's prevention or treatment, contraceptive methods like birth control, abortion, sexual assault services, emergency medical services, and then child abuse diagnosis services. And in the state of California, minors 12 and over have access to infectious and communicable disease prevention and treatment, HIV/AIDS prevention and treatment, STI services, outpatient mental health services, and then substance abuse treatment as well. All right. We're kind of near the end of the presentation, and based on what I've covered so far, I am going to give some recommendations to you as parents in the district and you as adults. All right, so the first is keeping your child safe. So get yourself and your child vaccinated to protect against HPV. That's the most important outcome of this presentation. I want you to get vaccinated, and I want your kids to get vaccinated. So talk to your children also about sexual health protection, like using condoms and getting tested for STIs once your child is sexually active. Help your children understand what STIs are and their health-related consequences. That's pretty important just to break down the stigma within your kids and within the district. And then obviously educating yourself is also a big one. Just be knowledgeable and be ready to answer your kids' questions if they're there. And then we're going to go back to the Mentimeter. So I'm hoping you didn't take it off your screen, but if you did, just go ahead and type in the same number. And we're going to move on to the next question, which is, how can I keep my child safe from STIs? So based on what you know, or based on what you've learned from this presentation, what are just some quick words or quick phrases that you can do to your children safe? The vaccine, education. Yeah, education is a big one. Open communication, sharing information and resources, just talking to them. Supporting them, that's a big one also. Communication. All right. So those are just, some quick things. Vaccination is an easy one. Education and educating yourself is also a big one, just to break down the stigma. communication and talking to them and supporting them. That's just great ways. All right, we're going to move on. All right. And the next recommendation I have for you all is just combating the stigma of STIs. So I talked a little bit about the effects of the stigma earlier, but in order for you to help break that stigma in this community and in bigger communities is to encourage healthy conversations about relationships and sex, and helping provide information to your children about STIs and the dangers of contracting one, providing information or access to protection and how to use it. So, advocating for that in schools is a big one. Get vaccinated and talk about why you're getting vaccinated and what it means to be vaccinated. And then embracing a non-judgmental approach to sex education with your kids. And this varies based on your relationship with your kids, based on your information and your beliefs. But being sex positive is kind of a good way to help break that stigma. And then also just a big one is be your child's ally. So just support them, talk to them, open communication like we talked about earlier. All right. And I believe this is my last recommendation for you. But a quick word on education and accessibility. So expanding access to condoms and birth control, i.e. breaking the stigma. So teaching your kids where they can find it, like Planned Parenthood or at Rite Aid even. Advocating for comprehensive, inclusive sex education. So including talking about LGBTQ+ sex education. I saw you guys mention that, sex education is mainly heteronormative and heterosexual, and it's important to advocate for a wide range of sex education to be taught within schools, including sex education that's especially for LGBTQ+ identifying students. Advocating for accessibility to condoms at the high school also. I'm a big proponent of condoms at the high school, and that's something that I'm working on personally also. So more support, the better. Alrighty. Thank you so much. If you have any questions or concerns or any thoughts, feel free to put them in the chat.
I do have a few questions.
Awesome. I'm going to go ahead and stop sharing my screen so I can see you all. All right.
So first question is, just as an adult, if I don't know if I've gotten the HPV vaccine, should I get it again, or how do I figure that out?
Yeah. So if you don't know, go ahead and check with your doctor or with your immunization records first. Then if you're under 45, you can get the HPV vaccine for yourself. You'll probably have to get 3 doses because, that's the most effective. Yeah, I hope that answered the question. So if you're under 45.
Another question. I seem to recall it was only 2 doses. What's the recommended time frame for the 3rd dose if you didn't catch it early enough?
Yeah, that kind of depends on what age you're getting it. For 11 to 12, obviously the 2 doses, 6 to 12 months apart. And I think it's the same for the first 2 doses if you're older. And then the 3rd dose, I assume, is probably 6 months later. But again, I think it depends on the age in which you're getting it.
Yeah, I think it was about that with my kids, because for my older ones, I didn't know to get it at 11 or 12. So poor guys had to have 3. Obtaining this vaccine for one's children seems like a no-brainer. Is the controversy because of the fear in parents that it may encourage sexual activity, or because of a general anti-vaccine mentality?
I think it comes from a lot of things. And one of them is, people think that if you're going to get the HPV vaccine and you talk to your kids about HPV, it's going to encourage them to have sex, which is completely not true. And it's actually been proven to be false. I think a lot of it also just comes from, my kids aren't having sex. Why do I have to get this vaccine if they're just not having sex? I'll do it later. And then when they say you'll do it later, either they have to get more vaccines and that's just inconvenient for them, or they just forget about it. And then their kids are never vaccinated against HPV and can actually get cancer from it. So it's a collection of things, but I think the main one is, I forgot and it's too late, or, whatever, something like that.
Great. Are condoms available at the high school?
I'd love to talk about that. Last week or a couple of weeks ago, me and my, co-health and wellness officer, we did this whole STI awareness campaign where we posted a lot of flyers around school. We did some Instagram posts and stuff like that. And then at the end of the week, we ended it with the condom distribution at the school, in which we ran out of condoms in like the first 10 minutes of lunch. So clearly condoms are wanted by the students. Whether or not they're using them, just to play with them, or if they actually need condoms, I think it's in both ways. It's actually a great like, it's great. If they want to play with them, at least they know what it feels like. If they know what it looks like, they know, what it's for. But right now, condoms aren't at the high school, or they aren't in the nurse's office. So that's something that we're advocating for with the administration and with the nurse, to get them available for students in the nurse's office if they need them. But we did end up giving some condoms to the health teacher, whose name is Miss Jill Timothy. So you could also talk to your kids about that. That's not something that's widely advertised at school, but it is available in the health teacher's room as of a couple weeks ago.
Great. And then how do we get this presentation out to students?
So that's another great question. I did a couple presentations at Pasadena High School, pretty much this exact same presentation, just geared a little bit more towards students. I have talked to the administration at the high school about giving some presentations at South Pass High School, but it was a whole bureaucratic deal and I didn't get that done. So I recommend, just giving this link to the recording so they can watch, this and take something away from it. Or I'm also going to put a resource sheet in the chat later, and you can just kind of share that with your kids as well.
Yeah, and just for those of you who joined late, we are recording this, and we'll put it on the PTSA YouTube page in the next couple of days, and hopefully Mr. Eldred will send it out at the end of the week, or you can just look at PTSA webpage, and we will put it in the PTSA newsletter next Monday as well. So it'll be there for people to see for a while.
Hop off and ask a question live. Hi, Anna Metcalf, Sadie's mom. Congrats, Sadie. Great presentation. When you talk to your classmates, and I know I see some here on the presentation, what do they say they know about HPV? Do they have any idea what it is? Are they aware of it and what it could do?
Yeah, I think a lot of people are aware of HPV and kind of what it is. I think they know it's an STI. I don't think they necessarily know the symptoms, or that there's actually no treatment for HPV, or that it causes cancer. The HPV vaccine is a very highly stigmatized topic, and a lot of people actually don't know if they've gotten it, obviously, from that survey that we conducted earlier in the year. So that's kind of I think the main thing to be aware of as a student is that is available to you and it can prevent cancer. But I have found that people know what HPV is, they just don't know what the vaccine is or how to get it.
Great. I don't see any other questions. So unless anybody else wants to unmute and ask.
I have a question. Sadie, are you available to do this? I know that you've tried to work in South Pass, but are you available to take this presentation to other districts like you did to Pasadena?
I would hope so. Obviously, I'm leaving school this year, but I'd want to give the presentation to other people. So if you have any contacts or any way for me to do that, I'd be really happy to look into it and take that on.
Okay.
So I think people need to know about it.
Yeah, definitely. Thank you. And presented by a youth, a teenager is also it allows kids and parents to be a little more comfortable, I think, rather than, somebody old preaching to young.
I think so too.
Students. Okay.
I think so too. A safer space, I think students feel when a peer is giving it to them.
Yeah.
Yeah.
I'm going to go ahead and drop the resource sheet in the chat. Sorry for the kind of long link, but if you go ahead and open that now, you can have it available.
Fantastic. At Pasadena, was it one school or more?
At Pasadena, I went to just the high school. I gave, I think, 2 or 3 presentations to different groups of kids. It was pretty kind of an open thing. So I think if I had taught it in a health class, I would have been able to reach more students, but I taught it in what's called the Wellness Center at Pasadena High School. So it was kind of a walk-in thing. So students could come and see it if they wanted to, but they weren't required to, which I would have liked. But again, I got some people. So I got some people.
That's great.
Sadie, can you hear me?
Yep.
So this is Larry Blankstein. I'm on the East Coast, so it's a little bit later here. And I just want to reiterate, I thought this was an excellent presentation. I think it's unfortunate this can't go, more wider than really outside of California, because it's relevant to all students, no matter where they are. And I think, as was said earlier, having a student give this presentation is much more powerful than having, someone else do it. And your facts and your delivery and what you did, I thought was excellent. And, if there's a way for this to go beyond just California, I think it would be helpful to all students to hear what you have to say and to protect themselves and to be safe. So I just want to thank you for this. And if there's a way to get this in a broader audience, I would encourage you and others to do that.
Thank you, Larry.
Okay, I think that's all for questions for the evening.
Actually, can I just ask one question? Sadie, do you know, from all the work you've been doing on this, which is fantastic, and thank you, have you heard much about how doctors are presenting the information about the vaccine? Because we have Kaiser Permanente, and we were told about it by our pediatrician right on time, right at the early age. There's a fact sheet, the doctor explains it, they talk about it, kind of right in there, along with conversations about all the other kinds of vaccines and physicals and everything else that we do at the doctor's office. So are you hearing that maybe people are not hearing this from their doctor during those other vaccine or physical times?
I could only assume, and I could only hope that doctors are giving this information to kids at the right age and their parents at the right age, and then also distributing information that's factual and easy to digest. However, I do think, because it's a semi-optional vaccine, it's probably not being as widely pushed on parents or widely taught in doctors' offices. But again, I could only assume, because I haven't heard directly from any doctors or physicians about this.
Or from other, maybe from the teens or other parents to tell you what their experience has been. Yeah, maybe it's just not picking up enough steam yet, even on that end.
Yeah, I know there's been tons and tons of public health campaigns about this topic, but again, it has to reach the right audience at the right time. And that's sometimes pretty hard to do. So, I mean, again, I'd only hope.
Yeah, Sadie, this is Ella Shadman. Speaking from a biased perspective, I am a primary care in Pasadena. I don't see children, but we are very strong advocates in general. Obviously, some more than others, but I am also always surprised when young people in their 20-something, even 30-something, aren't sure if they had it. And so there's a gap there. I think, those that have insurance and they have regular doctors tend to be more educated about it. Those that don't have a lot of access to healthcare certainly don't hear enough about it. Thank you for this talk, sweet. It was excellent.
Thank you, Ella, for that perspective. All right, if there's no more questions, I'm going to go ahead and pass it back to Kristen.
We're good. I think we're good. Thank you so much for coming. It's been wonderful having you here. And like I said, we're definitely going to get this out and show it to everybody. Hopefully we'll get a lot of views. We have noticed this year having things online is really helpful for people because they can't always make it. So thank you for letting us record it. I appreciate you being here.
Of course. Thank you, everybody, for attending.